way over at 360 Healthcare. I'm here with chiropractor Dr. Janine Rummel, and you're probably thinking that you remember being pregnant and you know what it's like, all the aches and pains that go along with it, and of course all the wonderful experience that goes along with it too. But if you are you just love chiropractic care and you realize the health and benefits of it, you might think if you're pregnant, you may have to suspend from that. But the good news is Dr. Rummel is certified in the Webster Technique, and she's here to tell us more about how to help your pregnant body through chiropractic care.
That's right, Liz. So I am one of the few chiropractors on the beach that is certified in Webster Technique. I'm a member of the International Chiropractic Pediatric Association. So the goal is to really enhance chiropractic for everybody.
And I wanted to show and demonstrate how this is a special pillow made for this technique where you would still be able to lay on your belly.
Yep, able to lay face down. These create a lot of support for the belly. That way I can accomplish Webster's Technique. And what the goal of Webster Technique is to really focus on mom and her overall health and creating the best environment for the baby. So we do that by focusing mostly on the small triangular bone at the base of the spine. It's called the sacrum. And then there are ligaments that come off of the sacrum that go to the uterus. So if there's a lot of tension and pulling there, it can create a lot of low back pain for mom.
Is this for also sciatica? Because when some people are pregnant, they'll have a lot of sciatica issues.
So the same nerves that come off of that sacrum and the low back that would go to the reproductive organs also go right down the legs. Okay. So sometimes we get a twofold of extra issues and also extra pain, but then we can also get the benefit of an adjustment, specific adjustment to the sacrum to relieve both of those problems.
If anybody's familiar with chiropractic care and getting adjusted, we still can't imagine, even with this pillow, getting manipulated. How does that work?
So really gentle techniques. I actually use a lot of the drop table. So a drop table just elevates slightly underneath you, and then just like it sounds, it drops from below you. Very, very gentle, the lowest setting I can put it on, or I'll use the activator. Activator is a handheld instrument that uses the same amount of pressure that my hands would, but in a smaller device. Okay. So a little bit goes a long way with that, and that's a great option too.
Now, I was reading about the Webster Technique, and that if you're having an issue with a baby, your baby being in a breech position, not ready for childbirth, is this something that could help create an environment that the baby would be able to turn around?
So the goal, if we're looking at a breech presentation, obviously for the baby not to be breached anymore, so what we want to do is try to create the best environment inside of mom so that baby is in the least amount of distress. Because the ultimate goal of any pregnancy is healthy mom, healthy baby.
Right.
So we obviously would like that to be as natural as possible too. So if we can take a lot of those ligament constraints off of the sacrum and off of the round ligament, that would set the baby up for the possibility to get into the best position.
So when these are too tight or something like that, it prevents the baby, in some cases, to be able to turn around and move comfortably?
Because they're constrained. They don't have all that nice open, not like there's a ton of open space, but it creates no space for them.
Pliability. And what kind of adjustment do you do to relax that? Like, what would happen?
So what we do with Webster is just apply very light pressure. Because really, to get a change with the nervous system, we're looking at about the weight of a dime. And that is all it takes. So very, very light pressure on a very specific area. We want to do the least amount to mom because she's already going through a lot. This is the most difficult job a human can have. So we want to keep pressure very light. The adjustment is very specific just to the sacrum. And then we do also work on the round ligament if there's trigger points. Kind of like what we would see with other techniques, except for now we would just do applied pressure because, again, mom's going through a lot, so we want to keep it very gentle.
So if someone is familiar with the benefits of chiropractic care and they come just to become more comfortable and relax and make sure they're not going to have these problems preventative, and someone could also come to you that may be told that their baby is breached, not in position yet.
Sure.
Could something like this prevent the need for a cesarean delivery or an uncomfortable situation or even a dangerous situation?
anything's possible. We don't put a direct label on, yes, this would fix all of those. Again, the goal is, if this is an ideal environment, then it gives the possibility that the baby can get in the best position so that then labor and delivery are quick and easy.
Now, let me ask you this question, because not talking about someone who's already pregnant, what if you're trying to get pregnant? Is this something that can help someone, I guess, conceive?
Absolutely. If all other fertility issues are not an issue, and just people are finding pregnancy is not happening for them, absolutely all the nerves that come off of the sacrum and off of the low back are also what supply the reproductive organs. So if we have non-functioning or not well-functioning nervous system in those areas, then absolutely that could be the prevention of what's not allowing them to get pregnant.
Okay. All right. Well, if you'd like to get your appointment with Dr. Janine Rummel over here at 360 Healthcare in Myrtle Beach, they can give you a call, right?
Absolutely. You guys can call us 843-692-9243.
And they're located at 4810 North Kings Highway in Myrtle Beach.